Good afternoon, everyone. I'm Mitch Pugh. I'm the executive editor here at the Post and Courier, and welcome to Beyond the Headlines, a regular virtual event that gives readers a deeper look into the journalism that we do here at the Post and Courier. Today, I'm joined by our health team, and obviously a team that's been very busy in the last 12 months covering the COVID-19 pandemic, and now hopefully what we are on is the road to recovery. Very excited to have both these individuals here. And, I'll just take a quick second to brag a little bit. I really firmly believe that between the two folks you're going to meet today, that we've got the best health team in the Southeast. And they, I think their track record and the awards they both won back that up. So I'm really excited to have them here today. I think it's going to be a great conversation. And I look forward to hearing your questions. Just so everybody knows, we did get some questions submitted ahead of time, so we'll start with asking some of those. But if you have questions, you can go into the Q&A function at the bottom of the menu and ask those as we go, and we'll try to get to as many as we can. We'll talk a little bit more about this at the end, but when we're all done here, this show will be recorded. We'll be sending it to you in an email along with additional information, contact information, how to sign up for newsletters, etc. We'll talk a little bit more about that as we wrap up. But without further ado, I want to introduce the folks that are joining us today. First, we have Lauren Sausser, who is our health and environment editor here at the Post and Courier. Experienced, award-winning health journalist. Really grateful to have her here again. We also have joining her another very experienced and decorated health journalist, MK Wildeman. She's been at the center of our coverage of COVID-19 for the last year, and really an incredible resource for our readers and for those that are following this all across the state. So I'm going to start by asking each of them just to talk a little bit about what their job is, how they approach that job in covering COVID-19 this year, and then we'll get to your questions. So Lauren, why don't we start with you? Tell us a little bit about what you do and how you've approached the last year.
Sure. Hi. Thanks for having me. I'm happy to be here. I've been at the Post and Courier for a little over 8 years now. I started at the very beginning of 2013 as a healthcare reporter. I was the only healthcare reporter in the newsroom. Back then, it was a lot of Affordable Care Act coverage. The healthcare law had been recently passed in Congress, and states were busy implementing it, and that shaped our coverage as far as healthcare goes for several years after that. We added more reporters to our team as we realized that it was a bigger job than one person could handle. And obviously, this past year has been dominated by the pandemic. And I've said it before that everyone in the newsroom has had to become a healthcare reporter this past year. Every story essentially is a pandemic story these days, it seems like. So that's, what we do. I am still reporting some, not as much as I used to. I'm mainly editing reporters on my team. We cover health and science, and so I have three really talented women, MK being one of them, who cover these issues, healthcare, climate change, and science. So anyway, yep, that's a little bit about what I do. MK, do you want to fill in any gaps that I left out?
Yeah, of course. So I came to the Post and Courier about 4 years ago to work for Lauren. And when the pandemic came in March, I was a business reporter covering healthcare kind of through that lens. And so for like a good portion of the beginning of the pandemic, that's sort of the lens I was looking at the pandemic through for the most part. And then recently, over the last few months, we've transitioned me back to covering healthcare full time, which has been great. And I'll say that the pandemic has just been easily the hardest thing in healthcare that I've ever had to cover. Information changes constantly, public opinion changes constantly. So it's been very challenging. And yeah, I think that it's going to create some very interesting stories in the months to come as we think about our recovery and vaccination and reopening.
Yeah, it's going to be definitely. I don't think the story is going away anytime soon, and it has been. It's been an interesting year, as they both said. Every story becomes a healthcare story. Things like health and science and politics all meet here, which has made it both interesting and messy. So I'm going to jump into the questions, and so sort of maybe we'll start sort of in that kind of messy area. with the first question, which was from Bill Eisel, and he was wondering, he wants to, how different has South Carolina's approach to the pandemic and the reopening schedule been from what, for instance, CDC guidelines have been? I know there's been some variation state by state, but can you talk a little about how closely generally South Carolina has followed those recommendations and where they have veered off and why?
Yeah, I can kind of start to answer that. And Lauren, if you have anything to add, I'd love for you to do that. I mean, I think that Bill, your question was, specifically about like what CDC guidelines we have and whether we've stuck to them. And I think that for the most part, the CDC hasn't laid out really specific plans for states. Like most of their recommendations sort of pertain to schools, businesses, individuals, and then a lot of this sort of state reopening plans, either the states have created them themselves, or there's been like some guidance from the White House. And now we've, of course, had 2 administrations sort of dictating some of those guidelines that they want states to follow. It's interesting. We wrote a story back in April of last year, so a year ago now, if you can believe it, about how well we stuck to the Trump administration's guidelines to reopen. They sent out a big list of guidelines they wanted us to have before we move forward, and South Carolina was not adhering to those closely. If that kind of gives you an idea of like how our state has approached reopening. I think there's a handful of states that have really favored a personal responsibility sort of approach. And I think it's just really hard to judge whether or not which approach ended up being the right one. Probably have to wait a couple of years before we really get our arms around that. But I just wanted to point out schools is one example. Like the CDC does have pretty specific guidelines around schools, and has said is I think most people know that schools being reopened doesn't lead to community transmission, or isn't known to lead to community transmission. I think South Carolina's adhered pretty closely to that. Lauren has children, so I think she probably could say better than me. And then another example would just be long-term care facilities. Our visitation guidelines did adhere pretty closely to what the federal government wanted each state to do. So it's been a mixed bag. It would be my take.
Lauren, is there anything you wanted to add to that?
No, I think that she really covered it comprehensively. Like she mentioned, it seems like every single state has had different, has approached it differently, and it is too soon. The ending of the story has not been written.
Yep.
Mm-hmm.
Well, we're getting closer because we have a vaccine now. And I don't know about the two of you, but I get my second shot Saturday. So hopefully I won't be bedbound for 24 hours. But obviously that's huge news for everyone. It's huge news for things like reopening. But there's a lot of questions still around what's safe, what isn't, after you've had the vaccine. So one of the questions we've gotten, it was from Ann Smith, and she wanted to know, what is safe to resume doing 2 weeks after you receive that second COVID vaccine, or your first with Johnson & Johnson? She mentions that she's been secluded from everyone since March of 2020. She's at high risk, for complications if she were to get COVID. So what's going to be safe for Ann 2 weeks after that final vaccine? Lauren, you want to take a stab at that?
Sure, I can start, and MK can fill in all the gaps. I'm lucky to have her, and I should also mention Shauna Adcox, and one of our reporters in Columbia has really been on top of the news this year, and I'm honestly just trying to keep up with both of these talented women every single day. So what we've been told is that after you are become vaccinated, after you get your shot, you are not immediately fully protected against the virus. So you can't just go out, an hour later and resume life as we used to know it. We're told that out in public, we should still be wearing masks. The reason for that is that the vaccines aren't 100% protective. I have a sister who's a physician here in Charleston, and she has been vaccinated and will continue to wear protective gear and masks to do her job, because that's the safe thing to do. The same applies to the rest of us. If you are congregating in groups where everyone has been vaccinated, it appears to be safe at this point for you not to wear a mask, which is good news. So if your family members that you've been secluded from, or your friends, have also received their vaccine, and it's been that the incubation period for that specific vaccine that you received has passed, you are safe to gather with groups who have also been vaccinated. There's a lot of stuff that we still can't do, but it varies city to city and state to state. Restrictions are different everywhere. MK, what am I missing here?
Yeah, not a whole lot, I think. I think that the only other thing I'd add really is that I know that these have been really uncertain times for people with chronic conditions, people with any sort of underlying health condition that makes them more at risk for COVID. And I know it's been a really nervous time for those people. I would say that you should feel free, in my opinion, to follow the CDC's recommendations for what you can do and what Lauren just outlined, because I don't think they would have released those recommendations unless they were really sure that it was safe.
So a similar question from Sharon around that area, and I think you sort of addressed this, but let's kind of dive mine in just a little bit more. So let's say I've got my vaccine. It's been my 2 weeks, but you're saying you should still wear a mask. Is it primarily, Lauren, as you were saying, because other people might not have been vaccinated? Or is it a concern about people that have been vaccinated still be able to be carriers? What's the rationale behind?
Well, in the answer is in some cases you won't have to anymore. But like I mentioned, it's not 100% protective. So even though once you've been vaccinated, it's quite unlikely that you can spread the virus to somebody else. You can still catch it yourself. There have been thousands of cases across the country of people who have contracted COVID after they've received their shot. Like I said, it's never 100% effective, and that's particularly true in the immediate weeks after you've gotten it. But the good news is that the thousands of people who have contracted COVID after they've received a vaccine, these cases appear to be mild. So that's not to say that something worse can't happen, but you're not out of the woods even if you get your shot. So when you're out in public, the recommendation remains that you wear your mask and socially distant, because the vaccine is not fully protective.
Anything you would add to that? Okay.
Yeah, I mean, I think it's one of those things where the obvious but unstated reason for the public health guidance, one of the obvious but unstated reasons for that public health guidance remaining in place is if people who were vaccinated stopped wearing masks, then that reduces some of that social pressure to continue wearing masks. And, as Lauren stated, like masks, for instance, masks are going to still protect you against the variants. And we see extremely high case counts in Michigan, where we know the variant has taken hold. And we really want to avoid that possibility in South Carolina. So there's a lot of scientific reasons to keep wearing masks. But also, I just think from a social perspective, if we stopped wearing masks because we are fully vaccinated, that, whether we like it or not, that does kind of reduce that social pressure for other people who haven't been vaccinated to keep wearing them.
Well, you brought up the variants, and that's not a question from a reader, but it's a question I hear a lot, which is, what do we know about the vaccines and the variants right now?
There's not a lot of definitive evidence, unfortunately. So it's one of those times when I wish the public health messaging was a little bit more direct and there was a little bit more transparency around what we know and what we don't know. Because I think the public health officials, they want us to get vaccinated regardless, because it is definitely the best thing to do right now. And Pfizer and Moderna, for instance, well, all the vaccine providers have said that they're more than capable of producing like booster shots in the event of, the variant taking hold where we live.
Mhm.
But yeah, I mean, I think it's tough. In South Carolina, we're not processing a ton of lab results basically for even determining if we have the variants, but our cases are sort of plateaued. Lauren, is there anything I missed there that you would want to add?
I don't think so. What I have read is that the news, the anecdotal and early scientific news that I have read suggests that there are reasons to be hopeful that the vaccines work well in protecting us against variants. Obviously, everything that we talk about, today, there's a caveat because we just don't know. I mean, we'll know eventually, but early indications suggest that we can be optimistic about that. Although, like MK said, I would not be surprised if in the future, we receive boosters for this virus regularly.
So,
which is, we get boosters for other types of vaccines throughout our life. So, I mean, that's not unheard of.
yep. So with that in mind, I mean, with the idea that, more people are getting vaccinated, if everyone's vaccinated, we can start getting back to some semblance of normal. I know there are a lot of questions about what could that mean for what normal day-to-day activities might look like. And one of the questions we got was from Wes Rashir, I think is how you say the last name. And he was specifically asking about colleges and university campuses. What's the likelihood that by, say, fall of 2021, and I'm guessing this might be a football fan, but I don't know. Yeah. By fall of 2021, what's the likelihood that we could see large group gatherings again? And, he says he's specifically referring to things like graduations, athletic events, other gatherings on campus. What do you think? What have you heard?
What I've heard and what I've read is that each university seems to be taking a different approach to how they're going to handle the fall. Mm-hmm. Some universities have announced that they're going to require all students to be vaccinated before they come back on campus. As far as I know, there aren't any colleges or universities in South Carolina that are going to require that at this point. Now, will that bar college students from congregating in really large groups? I don't know. Probably not. Based on what I've seen, the way college students congregate on King Street throughout this whole pandemic. What's going to be officially allowed, like inside a football stadium, I'm not sure. I would be shocked if it went back to normal, normal as we used to know it. That may never, I don't know. I mean, maybe we'll get back to normal one day. I don't think it's going to happen this fall. But I think that those discussions are actively happening on an individual basis on each campus. And what we see at the University of South Carolina might not look like what we see at Clemson. I think it's very much, like I keep saying, an evolving story. We are, MK mentioned, sort of in this plateau as far as cases go in South Carolina right now, but there are some states that are locking back down again. So just because we are in this lull right now doesn't mean that it's going to remain that way. Things can change really rapidly. I mean, if last year taught us anything, it's that I can remember this time last year thinking like, oh, surely I'll be able to go on vacation in July, right? I mean, it's so naive. So I am really loath to make any predictions about what the fall is going to look like. But so two answers are yes. I believe college students will be congregating in large groups, whether that's advisable or not. And two, I don't think the official word from the universities is going to be, let's just go back to normal. So it's going to be some hybrid.
Is there any indication, MK, from your reporting of what like CDC or the government's going to recommend that folks do? Like you mentioned, Lauren mentioned folks coming back and being required to have vaccines, but I've also seen, I think Nancy Mace may have just introduced a bill saying maybe not to give public funding to the institutions that require vaccines. So it seems like this might get a little political too, but what are you expecting to see in terms of recommendations for things like universities?
Well, the recommendations are definitely political, right? What I, kind of like I pointed out before, it's the recommendations themselves like aren't just coming from the CDC. However, I think that we've seen the CDC be very cautious in the recommendations it's made so far, which I think frustrates the public in some ways, but I think that they are waiting for the science to catch up, right? So they are definitely waiting for the science to catch up. So the problem is they have to conduct these studies in order to support their recommendations. And these studies take a lot of time and a lot of samples, right? Evidence. So, I mean, like Lauren said, I think over the last year, we've learned to be like really adverse to making predictions or even printing predictions that other people make, just because we learned our lesson on that so many times over.
Yeah.
And we turned out to be, that is everyone turned out to be wrong on what they thought would happen so many times. But I mean, I would be surprised if the CDC came out with some recommendation soon being like, big gatherings are now okay. That would be such a jump from where we are right now.
Great, that's helpful. So with that in mind, coming in from the Q&A function here, so if you want to ask a question live, go to the Q&A function, click on that, and type in your question. Tom Swansiger, after hearing you talk for a little while, I think is asking a logical question. Do you think that wearing masks will be the new normal?
MK and I were talking about that today a little bit. I don't think for everyone, nor all the time. Mm-hmm. But I think that because we've all had to do it, or most people have chosen to do it, I guess, this past year, it's the stigma has sort of been taken away from it. And I can see myself wearing one, if this year, obviously we had virtually no flu in the state or anywhere in the country, but, sometimes we have really, really bad flu seasons. I can see myself wearing one during those peak flu weeks in the future. Mm-hmm. All year round, all the time. God, I hope not.
Yeah, we were saying like neither of us really want to be wearing, it's not enjoyable. I don't think anyone's enjoying it at this point. I think that like for me, I'll probably keep wearing it in the grocery store. I think about my normal routine and think about those things that I do. I think that on like if it was a yes or no question, like, yeah, I do think it's normal now. Whether everyone wears them, like, no, definitely not.
Sure. Well, like we said, everything sort of is also shaped a little bit by culture and politics and other things that are that vary from community to community and state to state. So, well, I think we're getting close to the bottom of the hour. We would tell people to keep them until 12:30. But I got a couple more questions, and then we'll see if any pop into the Q&A. But one of the things that I'm interested in, and obviously I know you guys are too, is kind of thinking about from a journalism perspective how we're going to cover this moving forward. And as Lauren mentioned, the first few months, you're just sort of, in some ways, you're like a boxer in the ring, and you're just getting punched, and you don't know exactly what to make of it yet. And I think as we've gotten our feet underneath us, and we've gotten used to it, we've been able to sort of start, being more deliberate in how we cover it and think about it. But I'd like to I'll start with maybe you and go to Lauren. Just talk to me a little bit about how you're going to approach it as a journalist the next, couple of months in terms of trying to cover questions like the ones we've gotten today. How you're going to handle the science and the changes that are going to be coming, and dealing with things like the other day when they announced that the Johnson & Johnson vaccine was going to be put on pause. A lot of confusion around what that meant. And clearly, that's part of our job, is to help explain that. So, can you talk a little bit about how you're going to approach your job over the next month or two, and how complex that's going to be?
Yeah, it's interesting. I think about it a lot. I think covering like the first few months this year, y'all can probably imagine how rapid fire the COVID coverage has been just because of the vaccine rollout. So it's like, it feels like we're writing something every day about the vaccines. And I'll just say it's truly incredible the number of people who've been vaccinated already. I think we forget that. Millions of people have been vaccinated. It's amazing. And we continue moving forward at a pretty rapid clip. And I do keep a pretty close eye on it, and I think, but as we move forward, I think I want to think about the human stories, and I want to think about what people are worried about as they consider inviting family over, as they consider seeing their grandparents or their parents for the first time in months, as they think about putting their kids back in school or back in summer camps and that kind of thing. And I want to keep an eye on things like workplace safety, which is an area I think that we can continue to, hold each other accountable on. And so that's where I'm at. I think it's important right now to just sort of catalog the human story of getting back to normal in this really like uncertain historic time. So,
Lauren, anything you want to add to that in terms of how you're going to approach it as the editor?
Sure.
It all comes down to what Lauren wants. So.
Well, like you said, Mitch, last year, 12, 13 months ago, it was definitely, a breaking news situation. It felt like, every day it was overwhelming because in many ways, the tsunami had been coming towards us for months and somehow the whole country was caught off guard. That said, this is not the first time since my decade in health reporting that we've had a really highly charged, politically controversial healthcare topic. I mean, we and that's specifically why I think y'all have chosen to assemble this team of expertise in the newsroom, because we know that there's a lot of noise out there. I think one of the things that we have smartly decided to do over this past year is really pare down in our daily coverage the absolute essentials that people need to know on a daily basis without overwhelming them. And in terms of other coverage, so we are literally writing something about coronavirus every single day in the paper. In fact, it's usually in the print edition, which some of y'all may read. It's located in the same spot in the newspaper every day, so people can know exactly what we're going to report, and they've grown used to that. In terms of bigger coverage, I am always looking out for stories that sort of cut through the noise, that make people understand something better. In journalism, we call these enterprise pieces, tackling topics that other news outlets aren't thinking about, that other news organizations don't have the resources or the time to cover. They tend to be more complicated. MK wrote a really good story a couple weeks ago now about why South Carolina had been sort of floundering at the bottom of all states in terms of putting, and MK, correct me if I'm wrong, but putting shots into arms. And there was a good explanation for it. And when you broke it down by the brand of vaccine, it was clear that we were doing really good when it came to doling out the, which one was it, MK? The Pfizer vaccine, because the Pfizer vaccines had been given to the hospitals. But because South Carolina is a largely rural state, a lot of smaller clinics and pharmacies had been given Moderna and Johnson & Johnson shots, and were just simply taking longer because of the restrictions in their population base and giving them out. It made sense, and we were the only one, to my knowledge, who even pursued that story. That's the type of coverage that I'm looking for, that really explains something that people want to know, and goes a little deeper than what we might be able to accomplish on a daily basis. Those stories take days and sometimes weeks.
Sure. On that point, we did get one more question that came from the Q&A from Lorette Akers. She said that the recent transplant from California, this team is very impressive. Thank you. I agree. They're a good group. But she wanted to know how we're approaching, or any comments on what the long-term impact of COVID is going to be on people's mental health, especially this idea that we've been sequestered so long. And I've seen a little bit about that, but I think we still have a lot we don't know. But Lauren or MK, do you want to jump in and tackle that?
It's a great question, and it's something that a lot of people are really thinking about, a lot of experts. I know that the demand, and I wrote a story about this, I think it was last week, the demand for mental health services went up significantly during the pandemic, and that trend is going to continue to hold true even on this road to recovery, as we're calling it. It seems that children and teenagers have been particularly impacted. That's something that's really worrisome. I wrote a story a month or so ago now, where I interviewed several pediatricians and ER doctors who have seen kids with gunshot wounds and suicide attempts come into the ICU in numbers they've never seen before in their life. I mean, this pandemic, even as we are emerging from it, there will be implications from this for a decade and longer. And we're really only scratching the surface of what we know right now. And that's definitely a topic. Mental health is definitely a topic that it's a big concern for a lot of people, for sure.
Well, that's certainly sobering when you think about it. I know we're all very excited about the vaccine. We're very excited about the concept of being able to go to things like sporting events, maybe. But there is, like I said, there's still a lot we don't know, and there's a long tail to this. And that's why we hope that you all will continue to read the Post and Courier and read the news from this team. They've done a great job of covering it. We'll continue to stay on top of these things. We're at 12:30, so I'm going to wrap up real quick and just say thank you all for joining us today. We really appreciate it. This session has been recorded. You'll receive a link in an email shortly after we conclude here today. That email will also include contact information for your panelists, MK and Lauren. So if you've got additional questions, feel free to reach out. They may answer by email, or they may turn it into a story, depending on what it is. Really, appreciate that feedback. I know many stories this year have come from questions and concerns from our readers. So really do appreciate that. Also encourage you to sign up. There'll be a link there for the Health and Science newsletter that we do every week. It then encapsulates all of this coverage and helps you understand it. Really great newsletter. I really encourage you all to sign up. If you're on this call and you're not a Post and Courier digital or print subscriber, we'd really appreciate your support. You can visit postandcourier.com/subscribe and get a pretty good rate, especially for the digital side. So if you're thinking about it, we'll help you take a look. For those of you who are already subscribed, thank you. Couldn't do this critical work without your support and without your subscription. So very much appreciate the support of our readers, and makes all of this possible, makes Lauren and MK be able to have the time to spend weeks digging into a deeper story that really has an impact. So thank you so much for that. Look for your inboxes shortly here. We'll have a follow-up email. I have the links, have everything you need. Enjoy your Thursday afternoon as best you can. You put your mask on, I guess, if you go to the grocery store still, even if you've been vaccinated. I'll have to remember that after I get my second shot on Saturday. But again, feel free to reach out to any of us if you have questions. Thank you again for joining us. Thank you for your support if you're a subscriber, and have a great Thursday.
Two of us write about healthcare here at the Post and Courier full-time, which is so rare for local newspapers these days. The Post and Courier is owned by a family that clearly cares about this community. This is an exciting newsroom to be in. We understand that the policy decisions made in Columbia and made in Washington by our elected leaders directly impact people who live right here in the Lowcountry.